Hey friends, welcome to Therapy Thursdays on Louisiana Living. We are physical therapy and balance centers. I'm Angela Yarborough and this is Dr. Jerry Yarborough. And what are we doing here? Well, we are talking about different disease processes, and we are just talking about different ailments, different things that keep you from loving your life. That is one of our mottos, is love your life. And we just wanted to give back to the community and just give you some things that you can do for some things that might be preventing you from loving your life. So why don't you tell us exactly what we're going to be doing?
All right. First, like I said, I'm Dr. Jerry Yarborough, physical therapist, and my sweet wife, Angela. By trade, she's actually a nurse. So, together, I opened the Jonesboro clinic about 20 years ago. I actually have about 27 years experience as a therapist. And then 7 years ago, we opened up here in Ruston. And just about 3 weeks ago, we opened up in ElDorado, Arkansas now. So what we're doing, like she said, is we're talking about different diseases or impairments that are affecting your quality of life. And at Physical Therapy and Balance Centers, our desire is to help you love your life. So we're going to discuss those impairments. We're going to discuss how physical and occupational therapy can help you rehab from those impairments. And then we're going to always give you a takeaway of what you can start doing immediately to start making a change in your life and improving your quality of life. So again, come and see us every Thursday here on Louisiana Living. You can look us up on myarclemis.com or our personal Facebook page, physicalruston.com. Or you can even go to our Facebook page or even our YouTube channel. We have lots of videos and lots of education out there to help educate the community. Now, we want you to come back in the next two segments in which we'll start talking about certain ailments or impairments. And then, like I said, what physical and occupational therapy can help you overcome those impairments. And then again, we're always going to leave off with what you can do immediately to start helping improve your quality of life. So come back and see us and we'll get started. Thank you.
Welcome back to our second segment on Therapy Thursdays. We are Dr. Jerry Yarborough and Angela Yarborough with Physical Therapy and Balance Centers. And we're continuing our discussion on shoulder pain. I have personally had experience with shoulder pain and I didn't realize how much it was really going to affect me until it affected me. Just simple things like brushing my hair, putting things in cabinets, my sleep. Oh my gosh, my sleep. I like my sleep.
Too, yeah, it affected us both.
Yeah,
so it really can be extremely debilitating. And millions of people every single day are battling shoulder pain. And shoulder pain can be caused by so many different things. It is the most complex joint in our body. And actually, just the shoulder joint itself has over 21 muscles that attach to it. And then when you talk about the shoulder girdle, you have even more muscles. Now the shoulder girdle is made up of our clavicle, our collarbone here, and then our scapula, which is the bone back here, and then the humerus is the arm bone, okay? Now the scapula is just free floating back there and is only attached to the skeleton through muscles and tendons. The shoulder joint is a ball and socket joint, like our hip. It's a socket and the ball sits in it. Now our hips are really deep. Our femur sits real deep into that socket. But our shoulder joint, that socket is very shallow, and the humerus ball is only held in that socket through muscle activation to help stabilize it in there and to move it. So again, so many things can go wrong. We're just talking about the three most common causes. A couple of weeks ago, we talked about shoulder impingement and how that can be caused. Last week, we talked about rotator cuff tears and how that can cause you pain. And today, we're going to be talking about osteoarthritis. That's a wear and tear disease of our joints. And so come back in the next segment. And as always, we're going to talk about the cause of the pain, what physical and occupational therapy can do to help you overcome this pain and impairment. And then as always, we leave you with at least 3 things that you can start doing today to help improve your quality of life and get back to doing the things you want to do. That's our passion here. So come back in the next segment and we'll talk more. Welcome back. I'm Dr. Jerry Yarborough with Physical Therapy and Balance Centers. Today we have my eldest daughter, Ashley, being our demonstrator. She's actually one of our CCSs and our techs and my assistant and whatever I need her to do around here. So she's a jack of all trades, and she's going to demonstrate some exercise for us today as we talk about osteoarthritis. Now, osteoarthritis, as I talked about, is the wear and tear disease of our joints, and that can happen in our shoulder joints, and to where the socket gets worn out, or even the head of the humerus gets worn out, and it starts to cause us pain as that wearing happens. So we're going to go over a few exercises here in just a minute. First, in physical therapy, we can definitely help people with osteoarthritis, working on different techniques to do opening up that joint. We have lots of different modalities that we can use with Class 4 laser, trigger point, dry needling, ultrasound, e-stim, all those things help promote the recovery from osteoarthritis. Research shows that physical therapy can help by strengthening the joint to protect it from pain. So now we're going to jump into a few exercises you guys can do. First, we're going to do a little distraction. You can hold like a 5-pound weight or something, just in a standing or even seated position. You can do this, just slightly bend forward and let that weight pull on your shoulder. You can just try to do that for about 5 minutes. You can even do a little rotation with your arm and then just relax some. Okay, that helps open up that joint space. That really feels good to people who have pain due to arthritis. We'll move from there to a shoulder stretch. You can push down into the chair and back toward your feet and step back until you're getting a good stretch. Remember, stretches should not cause you a lot of pain. Should be only a moderate stretch. And you're going to hold it for 30 seconds, and you're going to do that for about 3 times. All right, and then we're going to get into some strengthening. You can use something that's called TheraBand. We do offer this product here at all of our facilities. We're going to work on external rotation doing a hitchhiker exercise like this. You can start off doing it 10 times, and then as you build up, you can do 10 times 3 sets. All right, and then we're going to move into doing some shoulder extension. So you're going to straighten your elbow. You can hold it with one hand and come straight back. All right, and from there we're going to move into doing, you can put one end under your foot. We're going to work on forward flexion, like that. And then from here we're going to move into what's called scaption. It's a functional movement of our shoulder rather than just straight abduction, just kind of like this. And again, you're coming up. You're going to start doing all of these 1 set of 10, and then as you get stronger, you can do 3 sets of 10. So these are all really good exercises you can do to help decrease your pain from osteoarthritis. If this doesn't help, remember you need to seek medical attention, and you can just give us a call. And you have direct access in Louisiana and Arkansas to see your physical therapist. We communicate and work with your primary care providers very well.